to everyone.
Good morning.
Today we are going to see about the obstetrical forceps and the instruments. So I am going to give the general introduction about this, followed by me. The students, final year students, they will explain about the each forceps in detail. Each forceps as well as the instruments commonly used in obstetrics. So there are different variety of instruments used in case of obstetrics in order to make ease the delivery process. At the same time, in case of post-abortion or DNC operation, for this purpose, certain specialized instruments commonly used in obstetrics. Same like that, the forceps. The forceps means it is nothing but it is also some of the instruments. It is mainly used during the time of delivery to bring out the fetal head or to it is the delivery process. For the purpose we are using this obstetrical forceps. Now we are going to see, today we are going to see some of the instruments that is commonly used in obstetrics. So first I will call Ramzana to explain the one instrument. You choose one instrument and explain about the instrument.
This is Alice tissue forceps. This forceps is used to hold the apex of the cervix during DNA operation and catch hold the this is Alice tissue forceps. This forceps is used to hold the anterior lip of the cervix during DNA operation, and it hold the anterior lip of the episiotomy during
anterior lip of the perineum or rectal sheath. So while repairing the episiotomy, in case of any damage that occurs in the anal sphincter, means to repair, while repairing the anal sphincter to catch hold the rectal sheath, these forceps are commonly they are using.
And also this forceps is used to catch hold the perineum and the rectal sheath and the vaginal mucosa. And also it holds the margins and angles of the uterine flaps in LSCS after delivery.
During the LSCS delivery. So this is the Alice tissue forceps. It has the what it is called as it has the tooth in it, and it is very much helpful to catch hold the lip tissues. So that is why it's called as a Alice tissue forceps. Very good. Next, move on to the next person who is going to come.
This is joints retractor forceps. It is used to retract the abdominal wall and for the proper exposure of the lower uterine cavity during LSCS, and it is also reintroduced after the delivery. It is removed
once while time of taking out the baby. In case of LSCS, they will remove this joints retractor. After the delivery of the fetus, again they will reintroduce and they will explore the uterine cavity. So this is called as a joints retractor. Next.
This is umbilical cord cutter used to cut the umbilical cord.
Yes, this is used to cut the umbilical cord.
Then it is a Sims double-bladed vaginal speculum, and it is a double-bladed speculum has a groove in the middle. It is in the shape of concave. It helps to allow to drain the blood and urine while in the delivery, and it also used to detect the cervix and vagina and to check whether they have any injuries inside, and also it also helps after delivery to clean the vagina, and also it also helps to check the any bleeding which present inside the vagina after the antepartum hemorrhage.
Very good. Next.
This is called as Cuscus bivalve self-retaining speculum. So this has specialized two blades which is in concave shape. So this also has a specialized screw and a holder so that they doesn't need an assistant to open this. So this is used while during visualizing or inspecting the vagina and cervix, and also during collecting the smear for cytology purpose.
Yes. So this forceps we have to introduce in the this speculum we have to introduce in the closed manner. Then after that we have to once it is placing in the inside the vagina, then we have to bring back to the normal position and we have to open it and screw it to for self retaining. Next.
This is Koch's forceps, and there is a tooth at one side of the blade, and there is a groove on the other side of the blade for a better grip, and this is used to clamp the cord for a better grip.
And also it is used for membrane, the say rupture of the membrane in case of AR, artificial rupture of the membrane. Next.
This is metallic uterine sound. The curvature shape is helpful during adaptation of the shape of the uterus and easy insertion. It is used to detect the shape and size of the uterus during dilatation and effloration process before dilatation, and it is used to sound the uterus to detect any presence of foreign bodies. It acts as the first dilator of the cervical canal.
Yes, it acted as a first cervical dilator. It is mainly used, it has the measurement, is mainly used to know about the position and the length of the cervix, and also to detect any foreign product. It is mainly used before placing the IUCD devices inside the uterine cavity. So that's all about the some of the instruments used in obstetrics. Any one of you come and pick any one of this instrument and explain it. Any one of you. Any one of you come and come forward and explain about any one of the instruments.
This is known as umbilical cord cutter and it is used to cut the umbilical.
Yes, very good. This umbilical cord cutter used to cut the umbilical cord. So, any one of you say what is this?
Uterine sound.
Little bit louder. Uterine sound. So this is called as a uterine sound. What is this? Retractor. So I think so everyone understood about the instruments used in obstetrics. Thank you all.